This will be your first lesson of the course, so please stand up. And we'll call this a reference movement. So we'll be referring to it throughout. You will be doing something tomorrow and you will pay attention, the day after, and you will pay attention to this movement next week when we meet, and in 5 weeks. We will start each lesson with this cardinal movement. So you're standing and look right, look left. Feel what it's like for you right now. You could even, if you remember the spot that you're standing in, see that part of the carpet or floor where you're standing, and now turn right and turn left and notice what's your easy range without any effort. And memorize that. I see this picture frame on the right and I see this plant on the left, or whatever you see on the right and left. Memorize that. This is your beginning. That's the size of movement we evaluate now. Second part is how much of the movement you can identify throughout yourself. In other words, where do you move? Out of these 282 billion of options, where do you move? Do you move in your neck only? Do you move in the middle back? Do you move in the lower back? I don't anticipate that you'll be able to say, I'm moving at T6 more than in T3. That will take black belt of Feldenkrais and years and decades of studying to have such precision that you could identify specific vertebra. But in fact, when you turn, it is very likely that you're turning at certain places much more than others. And the worst part is that you don't even know that. And the only way we know it, because it starts to hurt later on, because when we move a lot, is starting to wear and tear. So feel quality, your understanding of movement right now. And now let's go as far from the head as possible. Pay attention to your contact with the floor as you're turning. When you turn left and right, simply, do your feet get involved in what you're doing, or they have nothing to do with turning? Now, I'm not saying start to lift your feet or do something intentionally. No, you just simply turn right and left and pay attention. What happens to your right foot? What's happening with your left foot when you turn? Does an arch lift on one side? Does it tilt? Do you shift your weight? And don't feel bad if you feel, I don't feel anything happening with my feet. What do you mean, Marek? I'm just turning my head. I think that will change shortly. Beautiful. Stop and please lie on your back. And now, arrange, you want to be very comfortable throughout all lessons. So if your preference is to lie on the bed, it's fine. You can lie on the bed. If you need head support, get yourself a folded towel or a head pad. Pillows, fine if they're firm enough. If they start to cradle your head, like a Tempur-Pedic pillow, they will not be good for us, because the Tempur-Pedic is cradling around your skull and therefore is limiting your movement. So thick pillows, the same story. They may actually inhibit your movement. It will be much better to get some kind of book, cover it with a soft pad, with a towel, or fold a beach towel or something. In terms of how high to make your head elevate, you want your forehead to be parallel to the floor or the ceiling. In other words, you want your head to be in a similar organization as in standing, not slanted forward as if when you have too many pillows, something like this happens. Your chin comes to chest and the forehead is slanted. If we put a little marble on the forehead, it will roll onto our nose. I understand with some of you, there is an issue of GERD or reflux that you need to elevate the head. If that's the case, that's fine. You need to negotiate the way you need to negotiate. Sometimes a little bit of a wedge will maybe a better option than pushing just the head forward. But you need to take care of yourself. Some of you don't need pillows. Some of you, when you lie on the floor, the forehead is parallel to the ceiling or to the floor. If you don't have enough pillows, your chin will be sticking up and forward and the head will be hanging back. This will not be an ideal because you'll see that the movement cannot travel down and will be just limited to your upper neck or upper middle neck. Great, so you're lying on your back, straighten both of your legs. Pay attention to your contact with the floor. Observe how much of you finds the floor now. Can be anywhere between 20 to 80% of the back of you touching the floor. And it varies. It varies from moment to moment, from day to day. But watch, would you say you're flat? Or would you say that there are bridges, there are arches, large arches in the neck or lower back? Again, don't do anything to change it. Don't use volition for improvement. Our goal, my goal as a teacher, is to help you move and control movements, control posture, not through your upper centers of your brain that require attention and awareness, but through lower centers that are more spontaneous, that are automatic pilot. This saves you energy. If you had to think about every step you make and every component of your gait, it will be impossible to walk through the room. You need to rely on what's called central pattern generators, those parts in the lower centers of your nervous system that control movement automatically. They do their job and you don't even know they're doing it. For learning, however, we use awareness. Watch your length of your spine from your tailbone through your lower back, through your middle section of your back, observe your neck, observe your breathing. What's your breath like right now? Inhales, exhales. Are you breathing quietly? Or is the breath a little bit challenging or held, strained, shallow? And again, if so, don't change it. Observe, notice. It will change. Now, bend both of your knees, please. Place your right palm on your forehead, with your right elbow a little bit out to the side, providing that your right shoulder is comfortable. If it's not, if you need to lift it toward the ceiling, that's okay. The elbow can be to the ceiling. Again, your comfort, your safety is utmost important. And now with your palm, roll your head to the left and then come back. And pay attention to the quality of this movement. Repeat this several times. We'll do every sequence several times. As soon as you feel signs of fatigue or tiredness, or even your paying attention gets distracted, then you stop. You put your arm down. But for a few times, you push your head very gently to the left and come back. Can you sense the skin of your forehead as you're beginning to push? The first tissue that may actually respond is your skin, fascia, and muscles that cover your forehead. Can you feel a little bit of glide underneath your fingers? And then you find that your head, your skull, starts to respond. Very gently, back and forth. Time this movement with exhalation, out breath. In breath as you return, out breath as you roll to the left. And you make it small, you make it slow, you make it gentle. Good. Stop, place your hand down, rest a moment. And now place your left hand on your forehead. Left hand on your forehead with the fingers to the right, and begin to invite the head to roll to the right. And sense whether there is a difference in the quality of movement. Sense if does the head move exactly the same to the left as to the right, or is one side freer? And stop at the first sign of getting in your own way. Remember that cross motivation slide. The first moment where you feel a glitch, the first stop where you feel a little bit of resistance, don't ignore it and don't counter the problem with more effort, but with pushing harder. Back off and do it again. And back off and do it again. When you go so slowly and so lightly, and the movement is so small, you will find that the movement starts to improve by itself. It's not through stretching the limits. It's through your nervous system finding out how to inhibit that cross motivation, that holding. Because basically what you feel when you start to turn and you feel that first glitch, that's the place where it's not turning, or maybe even is trying to turn in the opposite direction. And you back off. Wonderful. Stop. Put your arm down, stretch out your legs. Pay attention if already after just a few minutes of rolling the head with one hand, with the other hand, if something about the way you contact the floor is already different. Observe your shoulders, your shoulder blades, contact of your ribs. Observe how the head is lying on the mat, whether your nose is oriented a little bit to the right or left, whether one side of the neck feels shorter, or if you find more and more symmetry in you. Observe your breathing. Pay attention to your sense of safety. How safe do you find yourself right now? Sometimes we feel very safe, very secure. Our breath is peaceful. Our mind is calm. And sometimes we're a little antsy, a little bit nervous, a little bit stressed. Our breath is shallow. Muscles tense up. We brace ourselves to survive, to manage, to cope. Again, don't try to change anything. Observe your state, because that state will be changing. It will be adjusting as a result of these movements and you paying attention. Place both knees back to standing. if you're comfortable. Put your right hand on the forehead. Let's spend a minute on improving our contact of the hand with the forehead. So here are some variations. What we want is the hand to be pretty flat. The palm and fingers are pretty straight and flat. We don't want cradling. So go ahead and cradle your forehead as if you were cupping it. And do the turning of the head while the hand is cupping or cradling it. And notice, what does that feel like when you are holding the head instead of the palm being just flat and suggesting the roll? When you have a cupping on your forehead, would you say that the movement is more expensive, or is it more narrow, more limited? You might actually find that with cupping, that lower cervical spine, those shingles, remember the rooftop, the shingles, you feel more of that kind of movement. Now, flatten your palm. Don't try to cradle. It's okay if, as you push your head to the left, if your fingers lift away from your forehead and the point of contact actually moves toward the heel of your hand. And then as you're coming back, point of contact returns to your palm, to your maybe fingers. Feel, what's that like? If you can sense your hand not stiffly held into a plank position, but softly, at the same time straight. Another place to improve is your thumb. Many of you will have the thumb in opposition. What we want is the thumb to be part with the rest of the fingers. So it's pointing pretty much to the left as the rest of the fingers. Let's see if we can feel why. Go ahead, place your left hand on your forearm. So your right hand is still on the head, just like you had it. And now palpate the muscles of your forearm from the elbow a few inches down. And now palpate and feel how soft or how hard those muscles are. Begin to oppose your thumb. Stick your thumb as if you were doing thumbs up sign, and feel what happens, how the muscles of your forearm start to contract. So you can use your left hand to actually cradle all around the muscles of your forearm, and then listen to what happens when your thumb sticks outward. Can you feel how hard these muscles get? How tense? Those are the muscles that move your thumb. So the thumb goes out, you will feel more contraction in the forearm. When the thumb lies more or less together with the rest of the fingers, you will feel softer. See if you can identify that. And now when the forearm is soft, leave the touch of your left hand, put the left hand down at your side, and continue rolling your head gently. Your right hand rolling the head to the left, and then come back. And observe if you can save yourself some energy by not opposing your thumb. There are times where we need to oppose thumb, holding, gripping, manipulating objects. But for this particular movement, we don't need that. Beautiful. Switch hands and test the same thing. Put your left hand on your forehead. First of all, no cupping, no cradling, no catching with your fingers. The head is like almost like the hand is like a plank that rolls. What we want is the sensation of a conveyor belt, that your head is just rolling like a ball under a conveyor belt of your palm, of your hand. Touch your left forearm with your right hand, palpate, grab your right forearm around, your left forearm with your right hand, and test it, the feeling of what happens when the thumb sticks out. Can you feel how the muscles of your left forearm tense up, contract? Now do a few movements of the head like this with a tense up forearm and see what's that like. And then soften your thumb. No need to oppose. And roll your head to the right and observe the feeling associated with this movement. Beautiful. And put both of your arms down. Rest a moment. Stretch out your legs. Pay attention to the sensation of your forearms. So often our habits hide in form of clenching our fists, squeezing hands, tensing up our thumbs. Maybe you can sense something about how your wrists, forearms, arms are lying now that it's a little bit softer, a little bit less taut. And watch if the sensation of ease starts to spread through your arms, through your shoulders, through your chest, neck, jaw, and the rest of you. Please place your right hand again on your forehead. You know how to do it with the hand straight but not stiff, with the thumb relaxed, not held. And begin to roll your head to the left and back. And go back to that sensation of movement on the top of your spine and then of the lower parts of your neck. Now, this particular movement is not a true rotation around the axis because your head is rolling, right? Your head is traveling. The head is not spinning around the axis. The axis moves a little bit as you turn. So this may very much engage the vertebra of the lower cervical spine that create a little bit of that side bending of the nose, making a rainbow movement toward your shoulder and back. Listen to that. We can emphasize this. Put both of your arms above your head, elbows bent, and put both arms above you if your shoulders permit it. If don't permit it, again, there are so many options we will do. You don't have to do this movement. If your shoulder bothers you, you have a frozen shoulder, rotator cuff, or whatnot, you don't have to suffer. So if you can, you put your arms above your head, elbows are bent. And basically, I think of this movement like a heart of a bell. Your head is the heart of the bell that goes a little bit right and left toward the walls of the bell. Your arms are now the walls of the bell. Fingertips very close to each other, elbows bent, hands above your head, and roll your head from left to right. And pay attention as you're rolling, your neck starts to bend to the side that you're rolling. These are those shingles of the roof. The left shingles, if you turn the head to the left, slide downward. Right shingles slide upward and forward. And that's why we have this kind of rainbow movement. Then go to the other side, feel the same idea. And look that your vision, as you turn, you start to lower your eyes. As you go to the right, you look right and down. As you come back, you go to the height of your horizon. And as you go left, you're starting to look down and to the left. Now see, what would it feel like to do this movement on the horizon, that upper cervical spine? This will be much more challenging. There will be different lessons in upcoming weeks that will magnify, illustrate for you the upper cervical spine. Turn and feel. What would you need to do to keep eyes from moving down? What would you need to counter this natural bending of the head to the side in order to keep your head like a periscope? And then go back to rolling and allowing the rainbow-like movement right and left. Beautiful. Put your arms down at your sides. Again, right hand on your forehead and roll your head to the left and back. And pay attention to what's that like. What's your understanding of how your neck moves? Be very gentle. Be very small in your approach. You don't need to do a lot of movement in order to learn and improve, especially if your condition is such that you might have a neck trouble and every time you turn, you feel pain. Do smaller, do smaller. And if nothing works, remember we have those 280 billion, 100 billion of options. All right, let's tap to one of those options. Put your right arm down and bend both of your knees. Stand both of your knees and begin to lift the arch of your left foot. The inside border of your left foot. Lift it a little bit and then go back down. What you will likely to feel is that your left knee starts to travel to the outside. The left knee moves a little bit to the left and then come back. Again, you're starting at the base, at the very bottom of your foot. You supinate your foot. You invert the foot a little bit. That allows the knee to also tilt outward. Your hip opens a little bit and then come back. As your left hip opens, you start to feel that your pelvis is beginning to rotate to the left, doesn't it? Can you feel change in your lower back? A little bit of turning or shifting of weight toward the left side. Observe how high up your skeleton can you sense a shadow of movement. It starts with your left foot. Your intention is in your left foot. And the rest is a flow of movement. And feel, identify where the movement goes to. Maybe identify places that don't move. Remember those cross motivations. You might find, oh, my pelvis isn't turning. It just stays still. Or my lower back is not shifting. Or my lower ribs do not turn. I don't feel anything in my breastbone or weight shift on my shoulder blades. If that's the case, this is an example where the movement stops, where some part of you is not wanting to join or not knowing how to join. Maybe habit, maybe previous injury, maybe lifestyle, maybe work environment, maybe sport that you do. Everything can influence the formation of our habits. And you don't improve by pushing through, by trying to make that breastbone move or shift weight onto your left shoulder blade. You just go back and then return. A very small, lazy movement. And you listen to, where am I getting in my own way? My left knee goes outward because the left foot, the inside border lifts. Good. Rest a moment. Stretch. Relax for a second. Observe, length of your left leg. Observe contact that your left side is making with the floor. Left leg, left hip, left lower back, left ribs, shoulder blade perhaps. We want to get curious. When we encounter difficulty, like pain, we want to get curious, where else could I be moving so that place that hurts me doesn't have to hurt anymore? And this requires a discipline of awareness, because pain is usually such an attractor that's dominating. You feel that pain. Oh, that hurts. I don't like that. Oh, that hurts. So it's not necessarily inviting you to let me just continue and let me just look for other places. That requires really deliberate practice, movement practice. Bend both of your knees again. Let's differentiate, because some people feel the movement of lifting the arch and supination, and some people tilt the foot practically without movement in the ankle. Let's do this a few times. Open the knee to the right and don't move your foot and ankle. Think of your ankle is in the ski boot, and the only way you go on the outside border of your left foot is through knee tilting sideways, hip joint tilting sideways, turning. Do this a few times. Imagine you sprain your left ankle and you don't want to twist it. This would be a wonderful way to cope with that. Open the knee like a frog a little bit to the left, feel how the whole body starts to rotate, and you achieve lifting the inside border of the foot. Now, second variation, allow the ankle to move. Remove the ankle from the brace or ski boot and feel that you can invert your foot. You can supinate. The arch of your foot can dome a little bit, lift a little bit higher. And of course, that doesn't mean that the knee should stop moving. It can still move, but you are changing where you're moving from, where you're initiating the movement. And feel which strategy is easier for you, which one is more familiar, which one is closer to what you would call habit. Good. Stop, stretch out your legs and rest. Again, take a moment to feel how the effect of paying attention and moving. You might find one side of the back feels flatter, longer. Shoulder blades, observe. Is the contact of the two shoulder blades the same or different? Please bend your knees. Place your right hand on your forehead. Roll your head to the left and back and see if your turning of the head is better after what you did with your foot. If your hand meets less resistance. Because what we're doing here is we don't want the neck muscles to create the movement. It's your palm, it's your hand, it's your shoulder that creates the movement. Your muscles of the neck are soft. They're yielding rather than creating movement. Can you do this variation? Turn your head a few times from your neck, where your hand is just the passenger on your forehead. Turn it to the left by moving your neck, by contracting muscles of the neck that you normally use when you want to look to the left. And now switch. So the engine for movement is in your palm and your neck is free, soft, not tensing up at all. Can you make that distinction? Lovely. Now link what we did with your foot with the movement of the head. Every time your right palm, so bend both of your knees, every time your right palm turns your head to the left, lift the inside border of your left foot, open the left knee a little bit, a beginning of a frog leg opening, and then come back. Do this until you feel ease. You don't need to hold your breath. Your breath goes out. Each time you turn, your breath goes in when you return back to the middle. Exhalation to the left, inhalation back to the middle. Feel you turning your head and you turning your pelvis, turning your leg. Feel if you're starting to have glimpses that if you had very vulnerable neck and you wanted to turn but not moving your neck, could you use what you were just finding? Your left knee, your left foot, your pelvis, your lower back, your lower rib cage, shift of weight onto your left shoulder blade that will invite your head to turn left, but not because of some huge sharp motion in your neck, but with movement, engagement of vertebra below. After all, we could put a collar on your neck, right? You've seen sometimes people have after surgeries this very stiff, rigid collar that blocks the movement of the head and neck. See, would you be able to, for the head to rotate a tiny bit, completely without the neck, from the pelvis, from the ribs, from the shoulders? It's possible. Lovely. Stop, stretch out your legs, rest a moment. Either way, very gently roll your head left and roll your head right and feel if it's different, if your freedom of movement of the head is better. And freedom doesn't necessarily mean bigger movement. It may be that you feel, oh, my head turns a little bit further. But maybe it's also possible for the head to move the same amount, but still be better, meaning with less effort, with less strain. Great. Some of you may be tired of lying on the back. Please roll on your side or on your stomach, or if you're happy on your back, you can stay on your back. Before we do movements on the other side, let's take a few seconds to rest in a different position. Interrupting a pattern of lying. And lovely, come back onto your back. Bend both of your knees. Place your, this time, left hand on your forehead. Roll your head, invite your head to roll to the right and back. Your left hand on your forehead. Remember the thumb, remember the softness of the forearm. Remember the exhalation. Allowing the head to roll. Again, the engine for movement is your palm, it's your hand, it's your shoulder, not your neck. You yielding. And then you studying. Where's the first movement where I'm stopping myself? When first glitch, first increase of effort, first quiver of some muscles that oppose the movement. And then you don't plow through that. You are sensitive to that first glitch, and then you stop and go back, and then go again and come back. Lovely. Put your left arm down and begin to lift the inside border of your left foot. Again, watch. Are you using strategy of a ski boot, or are you making the movement from the ankle and the knee is secondary? There is no correct or incorrect variation. Just, of course, ideally, our entire system moves. Ideally, all of these 24 vertebrae and your eyes and your shoulder blade and your pelvis and your hip joint and your femur and your thigh, knee, shin, ankle, bones of the foot, all are organized that you do everything. But as we are learning that to integrate, it's okay to do it one way, then do it the other way. And every time you lift the inside border of the right foot, observe the weight is shifting on your pelvis to the right lower back. Can you feel your right lower back going a little flatter as the knee opens a little to the right? Can you feel those ribs that very often with many of us, they're arched and then they're held at the very junction between your lower back and middle back? Can you feel them flattening on the right side? Maybe the ribs on the left side arch, maybe left lower back arches. But on the right side, see, can you feel a flattening force? And then move on higher up with your awareness. You lifting the inside border of your right foot and observe your right shoulder blade. Can you sense your shoulder blade getting flatter? And reduce abruptness of movement. This is our practice. This is like meditation. You take the jumpiness that might be natural and you just breathe to it and say, no, I'm not going to get fast and strong, just slowly, and then back. Stop the movement of the foot, put your left hand on the forehead, roll the head to the right, see if this is better. After you did something with your right foot, maybe the head rolls a little bit easier to the right and back. Maybe you feel that shoulder blade flattening, lower ribs flattening when you roll just your head. Now let's link them together. For those of you who are not lying down, you could sit on the chair and you could lift the inside border of your foot and have your left hand turn your head to the right. So this could be very successfully done in sitting position as well, but not sitting on the floor, but sitting on the chair. So you can lift the edge of the foot. Link the two together. Head rolls right, inside border of your right foot lifts, and then come back. Exhale as you do this. Inhale, come back. Feel where's the first moment where you're speeding up or increasing effort of movement. This is the place where you could discover, oh, I could do less there. I don't need to accelerate so much, be so forceful. So here's where this work becomes more than just a movement, that kind of internal peace, quality of knowing how to deal with emptiness that our modern world stresses and tensions normally bring into us, and have a little bit of time where you work on, no, I'm not going to be just jarring and forcing and abruptly moving myself. I'm going to spend a quality time with myself, turning my head, gently exhaling, inhaling, come back. The feeling of emptiness may still be there in you, but your smarter you, the wiser you, can control that. Can say, oh, I'm going to breathe through it. It's like Thich Nhat Hanh was teaching about dealing with difficult emotions. Be like a good parent with the kid that is in tantrum, jumping, and you just, nope, you're breathing with them. You check their diaper, you do this, you do that, and sooner or later, they quiet down. The worst for tantrum would be to just shake the baby and like, what's wrong with you? What do you need to do? And no, be with them, breathe with them. It will pass. The same thing with our antsiness. Stop for a moment and rest, please. Learning to take care of yourself in the kinder way, loving way, accepting, not being forceful, not forcing the change. My neck needs to improve right now. It will improve when it's ready. But you create a process that will help it, and you'll be surprised how fast it can happen. Observe as you're lying on your back, what's your sense of width of your shoulders, openness of your chest? Is there a difference in how your body is lying on the floor? Please bend both of your knees. Place your right hand on your forehead. And this time, lift the outside border of your right foot. Lift the outside border of your left foot, of your right foot, sorry. So that will mean that your right knee is tilting inward. Both knees are bent. You lifting the outside border of your right foot and feel your right knee leans toward the left. Your right knee leans toward the left knee, toward the center, toward the midline. Do it as you exhale. As you inhale, you return your foot. And feel your pelvis is picking up on it. Can you sense your pelvis is starting to turn to the left? Now add rolling movement of your palm. So your right hand on your forehead, turning your head to the left every time you exhale and every time you lift the outside border of your right foot. Link these two movements in your turning menu. Exhale as you do that. Inhale, come back. Some of you will start to feel that, oh, if I wanted to, I could roll over all the way onto my side, but that's not necessary. Let's see if you can feel that as the shape of your back become more like rounder, less angular, less stiff, less held, where the shape of your torso become more like a cylinder, you'll feel that practically lightest of touches can make you roll over. Back and forth. You're lifting the outside edge. If you were skiing, you're bringing inside edge to the floor of your right foot. And the pelvis rolls, lower back rolls, ribs roll, and then your head is turning. And then come back. Lovely. Put your arm down, stretch out your legs. Pay attention to what's different now. Bend both of your knees. Lift the outside border of your left foot now. Feel how you flattening the inside border, the arch of the foot comes into the floor, and your left knee starts to migrate inward. Again, work on practicing quietness, peacefulness. Don't exercise. Sometimes we have an attitude of exercise, like how many repetitions? 10 times, 1, 2, 3, 4. Can you let go of that? This is not an exercise. This is a movement practice. You're listening. Because basically, what you rehearse is what you're going to get. If you're abrupt, if you're forceful, this is what you're going to learn, to be forceful. I don't want to teach you that. You have other teachers too for that. I would much rather to be the teacher of peacefulness and ease and mastery and patience rather than taskmaster. So don't be a taskmaster for yourself. Lift the outside edge, go inward, come back. Now place your left hand on the forehead and couple that with turning of the head to the right. So left outside border lifts and your left palm turns your head to the right. And feel the shape of your rib cage. Feel if movement will start to flatten the back, to release those excessive contractions that inhibit your movement. Gently. You have all the time in the world to improve. The harder you work to change it, the further you get from improving. Lovely. Continue, but now bring both edges to the right. So as you're turning your head with your left hand to the right inside edge will lift and left outside edge will lift. So both, like skiing, you go on both edges of the feet that cultivate rotation of your legs, of your thighs, movement of the hip joints, movement of the pelvis, movement of the lumbar spine, movement of the thoracic spine, all the rings of ribs, and finally penetrating and connecting with your cervical spine. Exhale as you go, inhale, coming back. And feel how else can you do it so it will be simpler, so it could be lighter. It's like musicians, you know, it's not for me to tell you how you should move, because I can tell you, move with entire spine, done deal, lesson over. But this is like somebody telling a musician, play nicely, or athlete. Well, just jump and release the ball, create a nice rotation, nothing but net, right? If this was that simple, it takes hours and hours of training. Musician playing and hearing and listening. No, it's not yet. Painter putting one coat after another. No, it's not the color that I'm after. The same thing is for us with the movement. You do it, and through movement, you learning and you polishing and you improving. Good. Stop a moment. Stretch out your legs. Stretch out your arms. Observe contact with the floor. How much wider, longer? Remember the 20 to 80% of the body surface touching the floor at any time. What is it like now comparing to when we started? Maybe you feel a little wider, flatter, longer. It's really unlikely that nothing would change. Now let's do it on the opposite side. Bend both of your knees, change hands. So now it will be your right hand on the forehead and both edges going to the left. The left inside border lifts, the outside on the right lifts. Both knees move, although not fixed. Watch, do you keep your knees as if you had a stick between your knees, or are you allowing a little bit of freedom? Because holding a stick means you're fixating something. You're fixating something in yourself. You're taking out of these billions and billions of opportunities and possibilities, you take some away. See if as you tilt both borders of the feet to the left, your right knee could maybe go open a little bit away from the left knee while the left knee is still tilting in. See if there could be freedom between your hips. Now, if you don't know what I'm talking about, go ahead, put an imaginary stick between your knees and don't let your knees move. Let's all of us do a couple of movements like this and see what happens in us. with the quality of movement. Keep the imaginary stick. Don't let your knees separate. Don't let your knees get closer or further apart. Keep them as one unit and feel what happens in you. Can you sense what happens to your mastery? What happens to the kind of flow of ease, peacefulness? Can you see that holding the legs together constrains you? And if it's intentional, fabulous. If this is a certain movement that requires your knees to be quite exactly the same, wonderful. You're the master of movement. But if it's compulsive, because right now there was no call to keep them exactly the same and not allow the freedom between the right and left hip. Beautiful. Just a few times. Exhale each time you roll. Exhale. Inhale, returning. And stretch out your legs. And pay attention to the contact that you're making with the floor. Observe your breathing. Would you say there is more movement in your belly, in your ribs, expansion, collapsing? Or would you say there's less movement in the abdomen and chest? And very gently roll your head, look to the right, look to the left, and feel what's different in your turning. Would you say that some parts of you, like your ribs, like your shoulder blades, like your breastbone, like your lower back and pelvis, begin to participate, show up for the movement of turning? Very nice. Stop. And please roll onto your side and come up to sitting. And then, at your own time, come up to standing. Stand where we were at the beginning of the session. Remember that spot on the carpet? We were looking right and left. We were paying attention to the visual field. We will do two things. One, the most important, we will be paying attention to the quality of movement, not size, but quality of movement, how movement flows through me. And then second is we will notice, what do I see to the right and what do I see to the left? Go ahead, turn a couple of times right and left and look if size of movement and if the quality of movement improved. Maybe you're finding that you don't need to hold yourself. You don't need to squeeze those shoulder blades or contract that belly or tighten your back while you're looking right and left. Maybe by softening these places, you're starting to feel the movement flow more through you. Observe your feet. Are they active? Are they part of this movement? What happens with the outside, inside arches of your feet as you're turning right and left? Can you feel when you turn right, the right arch of the foot lifts a little bit and the left foot maybe goes a little bit down? And when you turn left, can you sense the left arch now and your shin and your hip joint rotating slightly? Now make the movement even smaller and see, does that happen with a smaller movement? Do half of it, right and left. Are your feet part of this movement? And if not, what's holding them? Who's holding them? Lovely. And then walk around and sense what's different in your walking. How is your periscope of vision? How do you keep eyes on the horizon when walking around? Observe turning of your shoulders, your chest, pelvis while walking. And I understand some of our quarters are tiny, so maybe you need to just walk in place. That's okay too. Excellent. And then come back. I'll stop the recording.